Hey everyone, let's get right into it. Today we're taking a close look at a real game changer in Philippine law, Republic Act number 11036. You probably know it as the Mental Health Act of the Philippines. Now, whether you're a law student meticulously unpacking statutory frameworks for an exam, or just an everyday citizen wanting to know exactly what your personal protections are, this explainer's for you. We're going to demystify how the Philippines legally protects mental health, relying strictly on the text of the law itself to build a really clear, accessible picture of your rights. All right, let's dive into Section 2 because this is where the foundation is laid. The law states the state affirms the basic right of all Filipinos to mental health. Legally speaking, that is absolutely massive. It's not just nice-sounding words. This specific language takes mental health care from being treated as, a mere privilege or some secondary health concern and legally elevates it into an enforceable right for every single citizen. It literally changes the entire paradigm. So, how are we going to unpack all of this? Well, here is our roadmap. Number 1, defining mental health as a right, not a privilege. Number 2, looking at the rights of service users. Number 3, navigating consent and exceptions. Number 4, support in schools and work. And finally, number 5, state duties and legal penalties. Okay, moving into part 1, a right, not a privilege, understanding the foundation of the law. Now, as any law student will tell you, mastering a legal framework always starts with the vocabulary. The definitions dictate exactly how the whole thing is applied. Take a look at this first one. The law specifically uses the term service user rather than the traditional word patient. And that is highly intentional. Actually, it's a huge shift. By saying service user, the statute empowers the individual. It recognizes they play an active role in their own care, intentionally stepping away from older, kind of stigmatizing clinical labels. It covers anyone with lived experience of a mental health condition, including folks requiring psychiatric, neurologic, or psychosocial care. Next, it's really crucial to see how the law defines a carer. Section 4 explicitly states that a carer doesn't necessarily have to be next of kin or a blood relative. It formally recognizes the everyday informal support systems around a service user. Honestly, it's a brilliant legal acknowledgement that family is sometimes chosen, right? The law is saying that people who show genuine concern and maintain a close personal relationship absolutely deserve legal recognition in the care process. Then we have this concept of supported decision-making. This is a vital legal mechanism. It allows a service user to designate up to 3 supporters. What do? Well, they help the user express their preferences and intentions regarding the treatment. Think of it as a critical safeguard. It ensures folks keep their agency, their voice, and their autonomy when they're crafting their own care plans. So even when navigating really complex medical decisions, the user remains totally protected from undue influence or coercion. Let's move on to part 2, rights of service users, and the specific protections under the law. Here is where we get into the specific civil, political, and medical rights guaranteed under Section 5. This details exactly what every single individual is entitled to on an equal, non-discriminatory basis. We're talking fundamental protections, freedom from discrimination and stigma, guaranteed access to evidence-based treatment, and the strict confidentiality of clinical records. But I really want to slow down and pause on that 4th point, the explicit legal right to humane treatment. That means care entirely free from solitary confinement, torture, and cruel or degrading practices. No exceptions. This explicitly aligns domestic Philippine law with the absolute highest international human rights standards. And what's fascinating is how the law strikes a balance. On one side, Section 5 fiercely protects service users, making sure they have a right to informed consent and full access to their clinical records. But on the flip side, Section 7 protects the mental health professionals. Practitioners are legally guaranteed a safe work environment, continuous professional development, and crucially, the right to manage their own practice, which includes the right to accept or decline non-emergency patients. It's a beautifully crafted legal equilibrium. It protects the vulnerable while completely securing the operational rights of the medical staff. Okay, part 3, navigating consent and exceptions, looking at agency and emergencies. So the real operational power of this law comes down to the legal mechanics of agency and informed consent. Generally, a service user appoints their own legal representative for medical decisions. But what happens if they don't, or if they temporarily lose the capacity to do so? Section 10 lays out a very exact mandatory chain of legal representation. It goes like this: first to the spouse, then to non-minor children, then to parents, then to the facility director, and finally to a court appointee. This hierarchy has immense practical utility. If a family is trying to navigate a sudden medical intervention, this totally removes the legal guesswork during an incredibly stressful time. But here's a big question. When can medical professionals legally bypass this chain of consent entirely? Well, the answer lies in a very specific statutory phrase: psychiatric or neurologic emergencies. The law strictly defines this as a condition presenting a serious, immediate threat to the health and well-being of the service user or others, requiring immediate medical intervention. That specific emergency status, that is the sole legal trigger required to bypass standard informed consent. It ensures life-saving action can happen without a second of delay. But of course, bypassing informed consent isn't a free-for-all. It is heavily restricted. If involuntary treatment is initiated during one of these emergencies, strict safeguards immediately kick in. First, interventions must comply with any available advanced directives the user has already made. Second, involuntary treatment can only be applied while that emergency or impairment actually persists. Third, it has to be explicitly ordered by an attending professional. And finally, and this is a big one, it's subject to a mandatory audit by an internal review board within 15 days. The law requires immediate documented oversight to aggressively protect the user from any potential abuse of these emergency protocols. Let's transition to part 4, support in schools and work, and how this integrates into everyday life. Stepping out of the clinic and into the real world, this act dictates how the law impacts our daily environments to ensure true social inclusion. For students and educators, schools, colleges, and universities are now legally mandated to proactively integrate age-appropriate mental health content into their curriculums. If you're taking medical courses, psychiatry and neurology are now mandatory. Plus, both public and private educational institutions are legally required to have a complement of mental health professionals right there on campus. The law places the burden of early identification and support squarely on the educational institutions themselves. And if you're out in the workforce, this directly relates to your day-to-day job. Employers are now legally obligated to develop appropriate mental health policies and programs. They have to actively raise awareness, implement policies to correct stigma, and create actual systems to identify and support at-risk individuals. So having a supportive, non-discriminatory work environment, it isn't just good corporate culture anymore. Under RA 11036, it is literally the law. Every single person has a right to psychological safety at work. Finally, part 5, state duties and legal penalties, focusing on systemic accountability. Now, a law without any teeth is really just a suggestion, right? To ensure systemic accountability, the Act obligates the state to make major infrastructure upgrades. The Department of Health has to fund and establish community-based mental health facilities. This effectively decentralizes care, bringing it right down to the local barangay level. It also mandates the integration of drug screening services and the setup of 24/7 suicide prevention hotlines. Most notably, it gives a specific investigative role to the Commission on Human Rights. The CHR can proactively inspect facilities and investigate any complaints of involuntary treatment or abuse. Let's talk about Section 44, the penalty clause, because the consequences here are severe. Whether we're talking about a failure to secure informed consent, a breach of confidentiality, discriminating against a service user, or administering inhumane treatment, the law imposes strict liabilities. Violators are looking at actual imprisonment ranging from 6 months to 2 years. And if the violator happens to be a foreign national, they face immediate deportation right after they finish serving their sentence. Alongside imprisonment, courts can drop heavy financial penalties. Violators can be hit with fines of up to 200,000 Philippine pesos. I really want to emphasize that figure loudly. It proves that the state takes these legal rights incredibly seriously, including strict criminal, financial, and administrative liabilities, guarantees that the rights we've been talking about today are fiercely protected, not just empty promises on a piece of paper. Which brings us to our final thought for today. As we've seen, RA 10136 completely shifts mental health from a charitable privilege to a fiercely guarded legal right, backed by real safeguards, community mandates, and severe penalties. You now have a structured understanding of the law. So here's the question. Now that mental health is a legally protected right, how are you going to advocate for it in your own school, your workplace, or your community? Keep learning, keep advocating, and thank you so much for joining me on this explainer.